lacrosse ball prehab, low back and glutes. Today we're rolling out the low back and the glutes with the lacrosse ball. If you have any low back pain, sometimes that can be caused from glutes that are too tight. So I've combined both low back and glutes in this video for you today. If you have low back pain, give them both a try. So first off, we're gonna go up to the wall and we're gonna roll out that low back. This would be the beginner's guide to rolling out the low back. Take that ball, head to a wall, place the ball right on either side of the spine, right side or left side. Do not place it directly on the spine. So I'm gonna go right side of my spine, come up against the wall and lean into it. And all I'm gonna do is roll around right on that band of muscle that's on the side of my spine. At no time am I going to roll that ball across my spine. You can go up and down. You can go to side. What you're looking for is a sharp pain or kind of an ache when you roll over a certain spot that's tight. When you find a spot like that, stay on it for a moment and really roll right around that spot. See if you can let those muscles release. Go up and down. You can move the ball lower or higher, finding all those tender spots and rolling them out. When you get done with that one side, pull the ball out, go to the left side, again on one side of the spine, and lean up against that wall. The further your feet are out, the more tension and pressure you're going to put on that ball. If it's too tender, come stand a little further upright. That'll take some of the pressure off of the wall and off the ball. You want to spend just a couple minutes on both sides of the spine, finding any tender areas and rolling those out. That is the beginner's guide to rolling out your low back. This is the more advanced version of rolling out your low back with the lacrosse ball. So find a comfy spot, probably on a hardwood floor, a mat just so you're comfortable. It's a little harder to do on carpet, so I suggest finding a harder wood floor for this. You're gonna lay down on your back, take that lacrosse ball, and you're gonna slip it right underneath, again, on one side of your spine or the other, not directly on the spine. Lift the hips, come down onto that ball, and slowly release the hips down. If you have a very sore back, you're going to have to take this nice and easy, nice and slow. Roll around on that spot. Lift the hips up. Move the ball 1 inch down or 1 inch up. Slowly rest the hips down into the mat. Sink onto the ball. Roll that around. You want to do this multiple times up and down this one side of the spine. Each time you're going to lift the hips up, move that ball to a new spot, and slowly relax the hips down. Let your back sink into the ball. This will be very tender if you have a sore back. So just breathe in, breathe out, be very gentle. Again, keep doing that over and over on any of the sore spots in your low back. We are rolling out the glutes with the lacrosse ball. If you have any low back pain or just tightness in the glutes, you definitely want to roll out the glutes. Sometimes tight glutes can lead to lower back pain. So you're going to take this lacrosse ball, you're going to lift those hips up, place the ball directly under one side of the glute. I'm going right side of the glute for this one. You're just gonna roll around on that ball. Weight is in your hands. Now, to take this up a level, take that right ankle, place it on the left knee, opening up that hip joint, and roll around on the ball. Up and back, side to side. Wherever you find a tender spot, you want to stay kind of right on that spot and let that muscle relax. This will be tender, this will be sore. That is completely normal. Now, if you find a particular sore spot want you to stay right on that spot. And here's an added movement. Take your knee, bring it up towards your face, back down. You're staying on the ball, on that tender spot, but you are now rotating your leg. You will feel this. All right, once you've had enough on one side, simply come off the ball and switch sides. So now we'll place this ball under the left glute. Left ankle comes across on the right knee. And now we're leaning into the left glute, rolling that one out. Same thing, up and back, side to side. Find any tender spots. Stay there for a little bit longer. Roll right around the tender spot. And then add in the knee movement. Knee to the face, back away. About 10 times. And then you can roll, find a new tender spot, and do the same thing. And that is how you roll out the glutes with a lacrosse ball.